Okay, let's start getting ourselves set up and get everything ready.
Anything else? I just have to work.
Good medical lasers have been around for about 30 years now, going back to the early 1990s. But technology has changed. The evolution of the laser has dramatically improved what we can do, and we now have this incredible ability to treat patients that have all kinds of problems, and we can use one laser to do it. In the past, we needed a laser for pigment, we needed a laser for deep wrinkles, we needed a laser for superficial wrinkles, we needed a laser for blood vessels. So one of the big dramatic changes that occurred in laser therapy over the last 20 years has been to make lasers that do more than one thing. And that's where we're at now. We have lasers that allow us the technology to treat both the superficial wrinkles, the discoloration on the skin, the deeper wrinkles. We can now get some tightening of the skin. So we can do all of that with one session. And in the past, what we had to do to achieve that was to really thrash the skin. We had to have these lasers set at very high intensity. People would be literally raw for weeks. There was a very high risk of problems. Scarring was a constant aggravation and possibility. Permanent discoloration would occur, and people would have all kinds of problems in the healing process. So what we're able to do with the new lasers is to treat a person and minimize their downtime, significantly lower their risks of having problems, and yet achieve the maximum benefit. So we now have what's called a fractionated laser, and it sends in thousands of beams, leaving little spaces between them. There are several laser companies that have created that technology and that do very, very well. And there's basically 3 of them that have the top machines: Solta, Candela, and Luminous. And we happen to have a Candela unit. It's called the Core, C-O-R-E, because it sends in laser beams down into the deep core of the skin, and yet at the same time treats the surface of the skin with the more superficial beam. And when we do this, we can achieve wonderful improvement. We can do it with only giving you a cream on your skin for numbing. Okay, sometimes we'll add a pill that you take, but we never ever use shots anymore. We don't inject people. We don't need to put you to sleep. After the treatment, you can get up and go to work if you want. You can go home, you can take it easy. Over the few hours after treatment, what you're basically going to feel is some heat in the tissue, and if you use some ice pack or get a bag of frozen peas, frozen corn, put it over your face, within a couple hours all the discomfort's gone and you're back to normal. Over the next several days, you'll have some superficial crusting, and then that crust will start to fall off and you'll look like you had a sunburn. And generally by day 7, most of the sunburn quality has gone away. You have a little bit of persistent redness of your skin for another couple of weeks, but you can cover it with makeup. So really the downtime is just in the first 2 to 3 days where you have some scabbing. After that, the scabbing starts to go away. Most people are back at work within about 5 days. Certainly by day 7, you're back in the workplace. So we want to welcome you to ask any questions that you have. We'd like you to also recognize that these procedures are not nearly as expensive as you think. Along with the cost of cell phones dropping, the cost of lasers has dropped, and the amount of time and intensity of work that we have to put in to do your laser is a lot less than it was even 3 and 4 years ago. So it's amazing how affordable some of these procedures can be. So we hope we can help you out. We hope that if you have any problems, you'll think about our practice as a place, as a resource for you to go, and as a wonderful place to treat you and make you feel comfortable and help you achieve all that you can in terms of improving your skin.